Hello everyone, this is Eric Consiglio with Loesel-Schaaf Insurance, and I'd like to welcome you to our video. Topic of discussion, welcome to Loesel-Schaaf Insurance. So why the welcome video? Well, as you may know from recent communications, the Diocese has chosen Loesel-Schaaf Insurance to be their benefit consultant for the Highmark Health and Highmark Vision plans. We are replacing the current consultant, which is Hub, also referred to as BAI. This change is taking effect as of July 1st. And again, it's just for the health and vision insurance. So if you offer other insurances to your employees, like maybe dental insurance, disability insurance, or perhaps a different vision plan, it's going to be business as usual as it relates to those insurances. Also want to point out that we go by LSI because let's face it, Loesel-Schaaf Insurance is not the easiest thing to pronounce, and it's even harder to spell. Here's the notice you should have received a couple weeks ago regarding the change to our agency, highlighting the team members of Loesel-Schaaf that you'll be working with and everything you need to know as it relates to the change. Now, if you're like me and Audibles has ruined you from reading anything, I thought it might be good to do a video on this change to highlight what you need to know. So, what do you need to know? Well, as the consultant, our role is basically to help create the plans that the diocese wants to offer, implement those plans, and then make sure that they run the way they should and that the benefits are applying the way they should. So basically, we fix the problems that happen from people using the insurances. Now, to do that, we've developed a great team at our agency. And I always like to put some faces to the voices, so let's look at some of the picks here. On the consulting side, it's myself and my counterpart, Mike Ilya. I've been with the agency for 28 years. Mike's been with us for 31. We're the big picture guys. When it comes to the daily operations, these are the team members that you'll be working with. Kathy Fisher is the account manager assigned to the diocese account. So for the most part, she'll be your main point of contact for any problems, concerns, issues that may arise. Kathy's been with us for 23 years. When it comes to enrollments and terminations for plan members at the diocese, that's going to be Heather Himes that handles the administration of that. Heather's been with us for about 24 years, and you will be sending your Highmark enrollment forms and Highmark change or termination forms to Heather for processing. She'll process the changes, the adds, the deletions. She'll make sure everything happens accordingly within the Highmark system. And she can also help expedite ID card issues. I know oftentimes ID cards have a lag time in getting to the new members. So if you have a new employee that comes onto the plan as of perhaps September 1st, and coincidentally they have a doctor's appointment on September 2nd and they don't have their ID card yet, reach out to Heather. She can help expedite that so that the doctor appointment can occur and the employee doesn't have any hiccups. Invoicing, that's going to be handled by our invoicing team. They're going to be the ones that are responsible for sending out the monthly invoices for the health insurance that you'll be paying. That team consists of Teresa Gilmore and Courtney Buzzard. Teresa has been with us for 19 years. Courtney, she's actually a new employee of ours. She's been with us for about 3 months, so we haven't had an opportunity to get her picture added just yet. So that's a work in progress. Okay, rounding out the team. Claim issues, that's going to be Darlene Hill. Darlene has been with us for 23 years. We don't pay claims. Highmark pays the claims, but it's inevitable that employees will run into problems where they get bills that they shouldn't have received because the claim denied. Well, why did the claim denied? Oftentimes it can just be a simple error. So when employees get claim issue, when employees have claim issues, they're getting a bill from the doctor's office or the hospital and they're not sure why, or they're getting an explanation of benefit statement from Highmark stating that it's a non-covered service. Rather than those employees trying to figure out what went wrong by themselves, they can just simply call Darlene, and Darlene can be their advocate and work to see what the issue is and to see if it is resolvable. Going over to continuation of coverage in Medicare. That is Michelle Arrigo's side of the fence. Michelle's been with us for about 3 years now, so she's still in the honeymoon phase. So she will be administrating the continuation of coverage, which allows employees the option of continuing the diocese health plan upon termination of employment. More to come on the continuation coverage as we go through the video. She is also our Medicare guru, so as you have employees that are aging into the Medicare insurance, she can help identify and educate them on what they should be doing, perhaps not doing, things to that nature. So please feel free to point your employees to Michelle for any Medicare questions. Here's the contact information of the team members. As you'll see, we just have a main phone number, no direct dials. When you call our office, you will receive a receptionist and she will direct your call accordingly. Okay, housekeeping items related to the health insurance billing. As mentioned, that is Teresa and Courtney's wheelhouse. Nothing really new here, just kind of want to highlight how it works. The normal billing cycles, the first week of the month is when we'll send the invoices out, and it's for the upcoming month of coverage. That invoice is due typically 2 weeks after the invoice is mailed, and you have a grace period to the end of the month to make sure you pay the invoice. So just a quick example, the July invoicing, it was mailed on June 6th. It was due on June 20th, but if you didn't pay it by June 20th, you do have till June 30th to make that payment. And it's business as usual here. Send your payments to the lockbox, check payable to the Diocese of Erie. Please pay as billed. Want to stress this. Do not make any adjustments to the invoice. We will capture those adjustments on the following month's invoice, and you'll see any retroactivity that is supposed to apply. All right. Vision insurance, this is a change. As you may already know, Highmark is now sending you those invoices. So you'll submit the invoice directly back to Highmark with the appropriate payment. Because Highmark is handling the invoicing now for all the entities, they did have to assign new group numbers. Because new group numbers were assigned, that means new ID cards were issued to the members. So if the members haven't received new Vision ID cards, they soon will, but rest assured they can continue using the card that they have on file right now, because really the only thing that changed was that group number, which doesn't really affect anything when the claim is processed, because everything goes off of the member unique ID number. Okay, Highmark enrollments, Highmark changes, and Highmark terms. That is Heather Himes's wheelhouse, as mentioned. Effective immediately, we are responsible for administrating all the enrollment changes. So you'll use a Highmark enrollment form or a change form to make that happen. If you don't have access to the Highmark enrollment form or Highmark change form, just please reach out to Heather and she will get that over to you. Now, there's 2 ways to submit those forms to our office. You can either submit through our secured website, or you can kick it old school and fax it to Heather's attention. If you are submitting through our website, you're going to go to our site. Here's the landing page. You'll simply click on Submit Secure Document right here. That's going to take you to the following page where you will complete your name, your email address, your phone number, and then you'll indicate that this is supposed to be delivered to Heather Himes. So just type her name in there and she will get the document that you're uploading. Here is the Highmark enrollment form. Just a few points I want to highlight on this. The Highmark enrollment form does have a payroll location. The payroll location is how we identify what church or what organization you are within inside the diocese. The payroll location is found on your invoice. So the Highmark invoice, the health insurance invoice that you receive from our office, the payroll location is noted right on that invoice. When you come down to product selection for the medical insurance, you will indicate in this box right here whether they're enrolling into the PPO Blue plan or the Community Blue Flex plan. You'll bypass the dental because that's not applicable, and obviously check the vision box if they're enrolling in the vision. For the waiver section, this is important for the health insurance. Okay, so for the health insurance, if you do have an employee that is eligible for the plan but declines it because they maybe have coverage elsewhere or they just don't need it, then we do ask that you have them complete this section and submit this to our office. The reason this is important is due to the Affordable Care Act. The government now requires employers to report on who is insured and who isn't insured. So we need to know who the waivers are to make sure we're doing the reporting to the government correctly, and that happens on an annual basis. So please make sure that that waiver section is completed if it applies to the employee. Change form, if you're going to terminate somebody from the coverage, or maybe their address change is going to be taking effect, or they're going to add a spouse on or take a spouse off, that's this form. Please complete it accordingly and submit it as noted before. Okay, continuation of coverage. Continuation of coverage allows the employee the option of continuing the health insurance for a period of time. Now, technically, the diocese does not have to offer COBRA because they are a religious organization, which is COBRA exempt. But the diocese has decided to offer a continuation of coverage for the health insurance for up to 9 to 12 months, depending upon how big your organization is. And Michelle is the one that will oversee all of this. Okay, so if you do have an employee who is terminating, and they want to continue their coverage, they may be able to do so if a qualifying event occurs. Here are some samples of qualifying events: termination of employment, divorce, loss of dependent status, or death of an employee. If continuation of coverage applies, you're going to complete the continuation of coverage form. And then down here is the qualifying event that you will be checking. Okay, now it's important to note that whenever you have a continuation of coverage, you will actually also have a Highmark change form that accompanies it. Okay, because if you're taking somebody off of the plan, there's a very good likelihood that that's a qualifying event, and if it's a qualifying event, you complete the continuation of coverage form. So you would be submitting both forms back to Heather Himes's attention. So even though I just mentioned that Michelle administers the coordination of coverage, send both forms back to Heather. She will make sure the forms get to where they need to get to. And again, you simply do that by going to our website, submit through the secured portion, or you can, again, kick it old school and fax it to us. All right, closing comments. Guys, we're here to help. If you have any questions, concerns regarding anything I just shared in this video, or just the general operations of the plan itself, please feel free to reach out. We are here to help, and very much looking forward to working with the diocese for many years to come. Thanks so much. Take care.